Hello, everyone, and welcome back to another episode of Global Health Insights. I'm Jovina, your host, and today's episode are one you won't want to miss. We are going to talk about something that's been front and center of the world stage recently: zoonotic diseases and their link to global health. Specifically, we'll be discussing what role veterinary medicine plays in preventing pandemics. We all know that diseases like COVID 19, Ebola, and even the Zika virus started in animals before jumping to humans. But what many people might not realize is how vital veterinary professionals are in preventing these diseases from becoming global health crises. We are so lucky today to have two experts in the field. First, we have Dr. Renuga Devi, a wildlife veterinarian with expertise in zoonotic disease transmission in wildlife. And we also have Dr. Akila Fazana, an epidemiologist specializing in global health policy and infectious disease prevention. Welcome to the show, Dr. Renuga and Dr. Akila. It's great to have you here. We are also here with our moderator, Ms. Afika. Afika, thank you for being here, and I leave it to you to guide us through this fascinating topic. Over to you.
Thank you so much, Sylvina, and it's great to be here. Let's dive right in. To kick things off, for many of our listeners, the term zoonotic diseases might be a bit unfamiliar, so basically, what I got from my research, zoonotic diseases are diseases that can be infected from animals to humans. They include all the diseases that people can get from animals such as wildlife, domestic animals, insects, birds, and primates. For further explanation, Dr. Rinuga, could you give us a quick overview of these diseases?
Yes, zoonotic diseases are indeed diseases that can be transmitted from animals to humans, that they encompass a wide range of illnesses that can come from various sources. Some common examples include rabies, Ebola, HIV or AIDS, and more recently COVID-19, which is from animals, specifically bats.
Thanks, Dr. Rinuga, for that detailed explanation. It's clear that zoonotic diseases are a serious global threat. But what I want to dive into now is the ethical perspective surrounding this issue. Dr. Akila, zoonotic disease prevention can sometimes involve difficult decisions, especially when it comes to controlling wildlife or livestock populations. What ethical dilemmas arise in these situations, and how do we find a balance between public health and animal welfare?
Thank you, moderator. So, a great question. We talk about zoonotic disease prevention. There are often called ethical decisions. For example, killing animals during an outbreak is a common practice to control disease spread, but it raises questions about animal rights and welfare. The issues becomes even more complex when it comes to wildlife trade or habitat destruction, which contribute to the spread of disease like Ebola or especially the COVID-19. For an ethical standpoint, we need to balance public health needs to respect for animals and their ecosystem. Habitat preservation and wildlife conservation are crucial for minimizing the risk of disease spreading over from animals to humans. At the same time, we must ensure that any action we take, such as restricting wildlife trade or implementing stricter regulations, are done in a way that is fair to those who depends on these activities for their livelihood. That's all.
Absolutely, it's a delayed balance. Now, Dr. Renuka, you work closely with wildlife in terms of both conservation and disease prevention. What practical solution do you think we can implement to address some of these ethical dilemmas while also preventing outbreaks?
One of the most effective solutions is to enhance wildlife monitoring and habitat protection. By protecting natural habitats and reducing human-wildlife interaction, we reduce the chances of zoonotic diseases spilling over into human populations. Additionally, surveillance programs for diseases in wildlife population can help detect potential risk early. At the same time, we need better regulations around the wildlife trade to prevent illegal trafficking, which often brings wild animals into close contact with humans in unsanitary conditions. The One Health approach, which integrates human, animal, and environmental health, helps ensure that these interventions are effective and holistic.
Those are some great practical solutions, Dr. Renuka. Now, turning our focus to the economic impact, as we all know, the economic impact of zoonotic diseases is staggering. The cost of pandemics like COVID-19 runs into trillions of dollars when you factor in healthcare expenses, productivity losses, and disruptions in global trade. Dr. Akila, can you explain how zoonotic diseases affect the global economy and why investing in veterinary medicine could actually save us from some of this huge financial burden?
Absolutely. The economic impact of zoonotic disease is massive. For example, the COVID-19 pandemic caused trillions in healthcare, lost productivities, and disruptions to global trade. Here's how it affects the economies. For the first one, healthcare costs. Treating and controlling outbreaks can drain resources. Next, agriculture disease like avian influenza can lead to massive culling of livestock, disrupting food supply and farmers' income. And next, global trade. For this one, outbreaks cause trade restrictions and supply chain disruptions, hurting businesses worldwide. And the last one, tourism. Pandemics lead to the decline in tourism, affecting countries that rely on it for income. And now, investing in veterinary medicines can help prevent these costs. Stronger disease observations, early detections, and control programs can stop outbreak before they spread. It's much cheaper to prevent an outbreak than to deal with the economy fallout after it happens.
It really put things into perspective when you realize how much early intervention in veterinary medicine could actually save not just life but the entire industries. But we also know there are a number of key challenges in preventing zoonotic diseases. Dr. Renuka, what are some of the biggest challenges veterinary medicine faces when it comes to pandemic prevention?
There are several challenges, especially in lower income countries where veterinary infrastructure is underfunded. Without proper disease surveillance, outbreaks are harder to predict and control. Antimicrobial resistance is another growing issue, as the overuse of antibiotics in livestock makes it harder to treat diseases. Then there's the issue of illegal wildlife trade and habitat destruction, which increases human-wildlife interactions and create more opportunities for diseases to jump from animals to humans. We also face challenges in global coordination. There's often a lack of responding to outbreaks difficult.
These are such significant hurdles. Now, let's shift towards scientific solutions and the One Health approach. Dr. Akila, could you explain how the One Health approach works and how it relates to preventing zoonotic disease?
Of course, can. The One Health approach is a collaborative, multi-sectoral effort that recognizes the connection between human health and the environment. Zoonotic disease don't just affect one species or one ecosystem. The solution must be brought in interconnected. For example, when veterinarians work closely with public health officials to monitor disease outbreak in wildlife and disease animals, we can detect prevention zoonotic threats before they spill over into human populations. It's a proactive approach that focuses on early detections, habitat protections, and reducing human-wildlife interactions in high-risk areas. By adopting this integrated approach, we prevent disease from spreading across species and geographies, ultimately protecting human and animal health. That's all.
And from a public health perspective, Dr. Renuka, how does the One Health model influence disease prevention and health infrastructure?
The One Health approach has a profound impact on our ability to detect and respond to emerging infectious diseases. By integrating veterinary and public health systems, we are able to expand disease surveillance networks and enhance early warning systems. This approach helps prevent diseases from crossing over into humans and provides more robust data to guide our response strategies. For listeners looking for practical actions, they can take a few key steps, including ensuring proper hygiene, avoiding bushmeat, and supporting policies that regulate antibiotic use in livestock. From a more macro level, supporting legislation that funds veterinary surveillance and habitat protection initiatives is critical. We need a coordinated effort to ensure that our health systems are resilient in the face of future zoonotic threats.
Absolutely. And before we wrap up, what are some immediate actions people can take to help reduce the risk of zoonotic diseases in their communities?
First and foremost, we must practice responsible wildlife management. People should avoid handling wild animals or consuming bushmeat, as these are primary routes for zoonotic transmission. Supporting conservation efforts, reducing deforestation, and protecting wildlife habitats all play crucial roles in preventing disease outbreaks. Finally, education and community engagement are vital. By raising awareness about the risk and encouraging healthy practices, we can empower communities to act before a disease outbreak occurs.
Thank you both for such an insightful conversation. It's clear that the role of veterinary medicine in preventing zoonotic diseases is not just about treating animals, but is deeply connected to safeguarding human health, biodiversity, and our global economy. As we have discussed today, preventing these diseases requires a holistic approach with collaboration across human health, animal health, and environmental sectors. To our listeners, remember that preventing zoonotic diseases is a collective effort. The actions we take today, from practicing proper hygiene and ensuring food and water safety to supporting wildlife conservation and advocating for stronger public health policies, can help protect us all from future pandemics. It's about building resilience in our communities and systems to ensure that we are better prepared for what might come next. By staying informed, being proactive, and supporting efforts in veterinary surveillance, wildlife protection, and disease prevention, we can make a significant impact on global health. Thank you for joining us today on zoonotic diseases and global health. What role does veterinary medicine play in preventing pandemics?
Absolutely. We hope this conversation inspires action and awareness. Please share this episode with others. Subscribe to our podcast and stay engaged in this conversation. Together, we can create healthier and more sustainable communities. Stay safe, take care, and keep learning. Thank you for tuning in, and we'll catch you next time with more important discussion on health and prevention. Stay safe, everyone.